Yesterday morning, a picture of an asthmatic patient who died while trying to access the oxygen canister set up for asthmatic patients went viral on Facebook, causing an uproar on social media on how Port Moresby General Hospital was coping with the number of COVID-19 cases that continue to surge. In light of the recent post, the hospital in a statement has confirmed that the patient is an asthmatic patient who unfortunately succumbed while receiving treatment. She was one of the hospital's retired staff who frequented the emergency department to access the nebulizer to relieve her asthmatic symptoms. The statement from the hospital explains that there are strict measures that have to be implemented at PMGH in order to prevent transmission of COVID-19 to staff and fellow patients whilst taking care of COVID-19 patients, one of which include the reduction of aerosol generating procedures such as nebulization of medication for asthmatic patients. The statement went on to explain that in a confined space like the emergency department triage, this would have posed a greater risk to staff and other patients. Hence, to protect both staff and fellow patients, the nebulization for asthmatics was temporarily brought to an open air given the sudden increase in patient numbers, both COVID and non-COVID. The statement goes on that usually nurses prepare the medication and the patient holds the nebulizer. Given the fact that this was a regular patient, a retired health worker, and knows the process of nebulization, management is investigating what actually happened leading to her death. As it is, the hospital management is urging the general public to see the post on Facebook as a true indication of the real situation at PMGH, a much more overstressed and limited health workforce. This is only the tip of the iceberg of daily challenges PMGH has to manage every day. Others include logistical, bed space, and most of all, shortage of manpower, as many hospital staff that has been infected is now in isolation. 120 of them are from the emergency department. Port Moresby General Hospital is currently in a situation where more patients, both COVID and non-COVID, are presenting to be attended to by a limited and overstressed staff. The best the public can do to prevent PMGH and the entire PNG health system from collapsing is to reduce the transmission of COVID-19 by wearing a mask, avoiding public gatherings, and regular sanitizing of hands. And at Cora, National EMTV News.